Welcome to another Fireside Chat with Dave. This week we have a letter from Rick who writes, Dear Dave, I went to Shepherd Health Center because I was sick and they wouldn't give me antibiotics. Did they not want me to get better? Well, thanks for writing in, Rick. The Shepherd Health Center absolutely wants you to get better. However, they probably determined that you had a viral infection, such as a cold or upper respiratory infection. Since antibiotics only target bacterial infections, it simply would not have done you any good to receive antibiotics. People often think that antibiotics work for a cold because they take an antibiotic for 7 to 10 days and get better. The truth is that many infections only last a week or so, but it appears as if the antibiotics are what is working to make you better, when in fact you're just getting over it on your own. The problem with this is that taking antibiotics when you don't need them can actually cause more harm than good. Superbugs! That's right, folks. The overuse of antibiotics can lead to superbugs. These bacterial infections become resistant to antibiotics, making them very hard to treat. You may be familiar with MRSA, which is one type of resistant strain, but there are many others, including strep and E. coli antibiotic-resistant strains. And remember, antibiotics are prescription medications for a reason. Besides possibly creating superbugs, antibiotics kill good bacteria in your body, which can cause adverse side effects such as diarrhea and yeast infections. What's even scarier is it isn't just about you overusing antibiotics, but when society overuses antibiotics, you can be at a higher risk of contracting these resistant strains because they become more prevalent. So why do doctors prescribe antibiotics so readily? Well, because patients demand them, and patient satisfaction is a big deal in the medical world. Now, I don't want to scare you away from antibiotics. There are times when they are absolutely necessary to get better. What is important is that you listen to the advice of the Shepherd Health Center staff because they are following CDC guidelines and truly looking out for your best interest, rather than giving you a more or less placebo to make you feel better, because in the end, it can lead to serious problems for you and the larger community. Oh, but Dave, won't researchers just come up with better medications? Hopefully. But it takes about 7 years for an antibiotic to get to market, so don't hold your breath. The fact is that we just need to be much more careful about our use of antibiotics. Thanks for watching Fireside Chats with Dave, brought to you by Virginia Tech Health Education.